Today's theme is topography of the neck. We already know the muscles of the neck. And now, most practically important question, topography. First of all, let's discuss regions and triangles of the neck. In this picture, you can see a lot of topographical districts of the neck. So, two large of them is demonstrated here with blue color, and number one, it's regia colli anterior or regia colli medialis. Both of these terms are synonyms, are the same. So number one is regia colli anterior. And number two with yellow color is regia colli posterior or regia colli lateralis. So I'd like to ask you what muscle divides these two regions. Here it is. It's musculus sternocleidomastoidus. It divides the column into two large regions. And inside of these large regions, we can find also some triangles. They're numerated in this picture. Let's begin from the first. So number one is trigonum submandibulare. Here it is. Number one, trigonum submandibulare. Then number two is trigonum omodigastricum, or more often called as trigonum caroticum. Why such definition? Because here in this triangle passes arteria carotis communis, and then it divides into arteria carotis externa and interna. So that's why we use the definition as trigonum caroticum. Then number three is trigonum omotracheale, trigonum omotracheale. Then number four, trigonum omoclaviculare. And number five, trigonum omotrapezium. From number two till number five, you can understand the interesting feature. The name of each triangles has definition of two sides. One of these sides of triangle is musculus sternocleidomastoidum, and another side is musculus omohyoidus. And musculus sternocleidomastoidus we don't use in the name of triangle, but third side is, for example, musculus digastricus, trachea, clavicula, or musculus trapezius. They used in this definition. So if we forgot the name of this triangle, we can remember the sides of it, and using these sides we can call the name of triangle. So 5 triangles and 2 large regions. It's interesting that in anatomy, usually as neck, we call this anterior part of the cervical region and posterior part where we can find musculus trapezius and muscles behind of it, we usually call not as the neck, but as occipital-vertebral region. Occipital-vertebral region. So neck, in anatomical sense, it's only anterior part of round cervical region. And now number 6, it isn't triangle, it's fossa retromandibularis. If you shall try to palpate it in your own head, you are failed. Why? Because it's fulfilled by most large salivatory gland, glandula parotida. That's why it isn't empty, but being fulfilled, we can't palpate this very deep fossa retromandibularis. Okay, now if you have understand all in details, check yourself and indicate each of this triangle by Latin term. This is a special task for you. During watching video, make a pause and try to call each triangle. And now, next very important question, fascia of the neck. In Russia, we use our own classification according to Shevkunenko. And according to this classification, there are 5 fascias. So number 1 is Fascia colli superficialis. Fascia colli superficialis is a part of general subcutaneous fascia of the body, and we can say that it forms sheath for musculus platysma. Practically, each fascia is a connective tissue sheath which covers muscles or groups of muscles. And according to Fascia colli superficialis, on the neck, we can say that it covers by the sheath musculus platysma. So I can demonstrate it on this picture. Number 20 is musculus platysma. Here it is. And arrow with number 22 demonstrates that musculus platysma is in cover between fascial sheaths. So this is number 22 is Fascia colli superficialis. It means platysma is placed of this fascia and is covered by it. Then, number 2, lamina superficialis fascia colli propria. That means that fascia colli propria is a special sheath which is divided into 2 laminas, lamina superficialis, which covers the neck like a collar. It's interesting that English word collar is result from Latin word collum, or cervix. So this lamina superficialis looks like a collar which surrounds the neck from all sides. And we can say that it forms sheath for musculus sternocleidomastoidus and musculus trapezius. And another interesting feature of this lamina superficialis fascia colli propria is that it divides the column into two regions, anterior region and posterior region, by a special lamina which inserts to the transversal process of vertebra. I'd like to demonstrate it with this example. So you can see in right side musculus sternocleidomastoidus, number 3, and it's quite good seeing that during preparation we can find that it's really covered by lamina superficialis fascia colli propria. So on the left side, these fascia were not removed, so we can't see the muscles, but only its relief. So lamina superficialis fascia colli propria is covered musculus sternocleidomastoidus. Then number 3, lamina profunda fascia colli propria. Lamina profunda fascia colli propria, we can say it forms cervical sail, or according to the author name, aponeurosis of Riche. Aponeurosis of Riche. We can say that it is stretched between musculus omohyadus and sternum. It forms the sheath for muscles located lower the hyoid bone. How can I demonstrate this? Here it is, the picture where we can find musculus sternocleidomastoidus. Here it is. Musculus sternohyoidus. Here it is, number 4. Behind of it, we can find number 5, musculus sternothyroidus. Here it is. And laterally, number 6 is designated musculus omohyadus. Here it is. Musculus omohyadus. And this lamina profunda fascia colli propria looks like really cervical sail. This blue color demonstrates the position of this lamina. Only in this region between the musculus omohyadus from right side and left side, and between hyoid bone and sternum So all the muscles which belongs to the middle layer between osseoidum and sternum are covered by this fascia, lamina profunda, fasciae, colli propria. So laterally of musculus hiatus, we can't find this fascia. So it's placed only from anterior aspect. Then number 4, Fasciae endocervicalis. Fasciae endocervicalis. You can say that it forms the cover for cervical viscera. It means larynx, pharynx, and thyroid gland. And also, it consists of visceral and parietal sheets, and it forms spatium peritracheale communicating with mediastinum. Mediastinum is a complex of organs inside of thorax and spaces between them. So spatium peritracheale can be connected with mediastinum. By the other words, we can reach from the column, from the neck, the thoracical cavity, especially mediastinum. It's very important, for example, in situation of inflammations in the neck, when the pus could be migrated from the neck into the thoracic cavity, into mediastinum. And number 5, fascia prevertebralis, the last fascia of the neck. Fascia prevertebralis forms the cover for prevertebral and scalene muscles and continues in fascia endothoracica in the thoracic cavity. So 5 fascias according to classification of Shevkunenko. When we speak of fascia prevertebralis, we can use as a demonstration this picture. Here we can find all the 7 of prevertebral muscles. Here it is, longus colli, here it is number 5, longus capitis, musculis caleni, and small muscles, and all of them are covered by the 5th fascia of the neck, by the fascia prevertebralis. To try understand in detail this information, we should distinguish in such kind of transversal section of the neck, each from the 5 fascias, and distinguish all the muscles. So I use this list of terms. I shall not discuss just now this list of terms. You can make a pause during watching video and make a print screen, and then to print on the paper and colorize, like here, with different markers or pencils. But now we shall use this picture without any designation. It's the same picture, but no one designation. Let's find all the five sheets of fascia on this picture. First of all, letter A. This is Fascia colli superficialis. Fascia colli superficialis, which is in subcutaneous space and covers musculus platysma. Then I use blue color to demonstrate next fascia. And you can see that this blue fascia covers several muscles. What they are? Letter B in Russian demonstrates lamina superficialis fascia colli propria. And these two muscles, which are covered by color sheet, is musculus sternocleidomastoidus, here it is, and musculus trapezius. And also, we can say that from this fascia into transversal process of cervical vertebrae goes the special laminae which divides the whole neck into anterior part and posterior part. Again, it's good for any situation with inflammation, with abscess of the neck. For example, if abscess take place here in the occipitovertebral region, so there is a barrier between this inflammation and anterior muscles. So it's some of obstacle for development inflammation from posterior into anterior region. Then letter B of green color, several laminae, several sheets which cover the muscles located below the hyoid bone. What is it? It's lamina profunda fascia colli propria. Lamina profunda fascia colli propria of green color. And very important that we can find it only from anterior. And now I use the yellow color. Yellow color demonstrates fascia endocervicalis. We can say fascia endocervicalis surrounds the organs of the neck and neurovascular bundle of the neck. Here it is, vena jugularis interna and arteria carotis communis and nervus vagus. And this bundle is surrounded by fourth fascia and also glandula thyroida. Here it is, glandula thyroida, and trachea, and esophagus, they also covered by this fourth fascia of the neck. And last one, I use tragic black color. It's designated as Russian letter D and means fascia prevertebralis. Here it is, fascia prevertebralis. You can distinguish here musculus longus colli, musculus musculi scaleni, and they are covered by this black lamina, which designate fascia prevertebralis. So all these 5 fascial laminae we can find on this picture. But you know, there are always different classification. We can say is that this classification of Shevkunenko is proud of Russian anatomist school. But also there is more simple classification. For example, classification according to international anatomical nomenclature. International anatomical nomenclature. So, they speak that there are only 3 fascia. They call them as laminae. Number 1 with blue color, lamina superficialis, which covers musculus sternocleidomastoideus and musculus trapezius. Number 2 of green color, lamina pretrachealis, which covers the muscles of middle layer, belongs to the region lower than hyoid bone, and of this pink or violet color, number 3, lamina prevertebralis. Only 3 laminae, only 3 fascia. Sure, it's more simple classification, but students very often ask, what is right classification and what is wrong classification? I'd like to say that it's a silly question, because always it's possible to find any relationships between different classifications. So let's try to compare, to make a comparison of classification of cervical fascia according to Shevkunenko and according to international anatomical nomenclature. So we use this picture, and here from right side we shall demonstrate classification according to nomina anatomica. It means international anatomical nomenclature. And 3 laminae, lamina superficialis, lamina pretrachealis, and lamina prevertebralis. And on the left side, we can find 5 fascia according to Shevkunenko. And it's good seen that several of them, 3 of them corresponds to lamina, facial laminas of international nomenclature. So lamina superficialis fascia colli propria, it's practically the same as lamina superficialis in nomina anatomica. Then lamina profunda fascia colli propria, it corresponds to lamina pretrachealis. And fascia prevertebralis corresponds to lamina prevertebralis in nomina anatomica. So these three fascia, according to Shevkunenko, and three laminas in nomina anatomica practically coincides, they corresponds to each other. But nevertheless, in classification of Shevkunenko, we can find also fascia colli superficialis, which isn't seen in international anatomical nomenclature. And according to international nomenclature, is difficult to explain by what fascia is covered musculus platysma. But platysma has its own sheet from fascia colli superficialis. And also we can use the next yellow fascia endocervicalis, which covers internal viscera, internal organs of the neck. So you can find that these two classifications has a lot of points of connections. And sure, there are several differentiations. And now again, I'd like demonstrate you previous scheme and propose again to find here all the fascias which are designated by letters from A to D in Russian here. Okay, so if it's clear in this picture, try to use another. You already can recognize this picture, but now position of this picture looks according to person lying on the abdomen, supine position, and we look from the head on the transversal section of neck. So this scheme from Sapiens textbook, so it's very useful for you to distinguish different schemes. Again, I'd like to say that earlier, maybe 50 years ago, 100 years ago, you could watch such kind of pictures both from the position of the head and from position from the legs. But today, we usually use such kind of sections where we look from the aspect of the legs, Why? Because this is official tradition for radiological imaging. So this is most used position in CT, computer tomography, MRI, magnetic resonance imaging, and also in ultrasound examination. Okay. And now I'd like propose you scheme the muscles, organ, and blood vessels of the neck, which I recommend you to draw together with me, and then to recognize each structure. So, this is columna vertebralis. That means we again use position of person who lies on the back, and we are watching on this section from the legs. So this is most deep, this is most superficial structures. So now I use demonstration of all muscles, try to distinguish them. In the center, here it is larynx or trachea. Why or trachea? That means from the level of transversal section, on the level of fourth cervical vertebra, or on the level of the seventh cervical vertebra. It explains if we shall find a larynx or trachea. And also, this is the thyroid gland, and posteriorly to thyroid gland and trachea, we shall find esophagus. It's very interesting that in this section, esophagus, if we say that this is esophagus, so now we use section at the level of 6 cervical vertebrae, and we demonstrate that esophagus lies not in the central position, but it's placed to the left side. So it isn't centrally located, but asymmetrically into the left side. It's very important for recognition in radiologic imaging. And now several nerves and blood vessels. Now let's try to designate each structure. Number 1, what is it? It's musculosternocleidomastoidus, most large muscle in this section. Then number 2, quite thin muscle, it's musculosternohiatus. Number 3, more deeply located, is musculosternothyroidus. Number 4, here it is, number 4. Number 4 is musculus omohiatus. These 3 muscles belongs to the middle layer of neck muscles, which take place below the hyoid bone. Then, number 5, it's arteria carotis communis. Number 6, close to it, it's vena jugularis interna. And nerves inside of this bundle, neurovascular bundle of the neck, we can find number 7, nervus vagus, most large vegetative nerve of our body. And also we can find large muscles located quite deep. Number 8, musculus longus capitis. And number 10, musculus, excuse me, it's mistake here. We should write down number 8, musculi in plural, scaleni, musculi scaleni. And I shall change it. Musculi in plural, scaleni. Again, we shall repeat. Musculi scaleni, number 8. Number 9, here it is, esophagus. And number 10, musculus longus colli, excuse me, musculus longus colli. Number 10, musculus longus colli. Then, number 12, here it is, number 12, most superficial muscle, very thin, it's musculus platysma. And number 13, it's nerve, sympathetic nerve, sympathetic trunk, truncus sympathicus. So, I recommend you to remember this scheme. We shall use it in the electronic tests after finishing this last theme, biology. Next, very important and new question, intermuscular and interfascial spaces on the neck. Intermuscular and interfascial spaces on the neck. First of them is spatium ante scalenum. Spatium ante scalenum. It's located in front of the musculus scalenus anterior. That means between musculus scalenus anterior and musculus sternocleidomastoidus. And it contains vena subclavia. You can remember sulcus vena subclavia on the first strip, which serves for passing this vein, vena subclavia. Then number 2, spatium interscalenum, which is located between musculus scalenus anterior and medius, and it contains arteria subclavia and plexus brachialis. It contains arteria subclavia and plexus brachialis. Number 3, spatium previscerale, which is located between third and fourth fascias of the neck anterior to the larynx. Below, it communicates with the mediastinum anterior. It's interesting that between different fascias we can find very important spaces, which is especially important for surgeons during operations on the neck. And number 4, spatium retroviscerale. Number 3, previscerale. Number 4, retroviscerale. It's located between 4th and 5th fascia of the neck, posterior to the pharynx or posterior to the esophagus, and below it communicates with the mediastinum posterior. And last number 5, spatium interaponeuroticum suprasternale. Spatium interaponeuroticum suprasternalis. It's located between second and third fascias above the sternum, and it contains plexus venosus juguli. Now let's try to find these spaces in the pictures. So let's discuss intermuscular spaces on the neck. First of all, this black arrow. It's between clavicle, which was cutted, and musculus scalenus anterior. So what is it? It's spatium antescalenum, before, anterior to musculus scalenus anterior. Spatium antescalenum. We can say that is located in front of the musculus scalenus anterior. Here it is, musculus scalenus anterior. Or, in other words, between musculus scalenus anterior and musculus sternocleidomastoidus. But here, together with clavicle, musculus sternocleidomastoidus was cutted and removed. And this spatium antescalenum contains vena subclavia, and we remember about sulcus vena subclavia, which we can find here on the first rib. And second space is here between musculus scalenus anterior and musculus scalenus medius. And we can call it as spatium interscalenum because it's between two musculi scaleni, scalenus anterior and scalenus medius. But I mean, scalenus posterior, here it is, number 16. Scalenus anterior, scalenus medius, and scalenus posterior. Spatium interscalenum is between musculus scalenus anterior and medius. It contains arteria subclavia and plexus brachialis. It contains arteria subclavia and plexus brachialis. Now let's try to demonstrate interfascial spaces of the neck. Interfascial spaces. First of all, this arrow. Where is it placed? It's placed between third and fourth fascias anterior to the larynx or trachea. This is spatium previscerale. If we try on the specimen to enter by, for example, pincet or scalpel in this spatium previsceralis, so we should reach the mediastinum anterior in the thorax. And next, here it is, spatium retroviscerale, which is located between fourth and fifth fascias, posterior to the pharynx or posterior to esophagus. Here it is esophagus. So, spatium retroviscerale. Again, we can, on the specimen, enters here with the pincet, scalpel, and we shall reach mediastinum posterius of the thorax. So it's very interesting. And one else interfascial space, we shall use this black arrow to demonstrate spatium interaponevroticum suprasternale, which is located between the second and third fascia above the sternum. Here it is, sternum. We can say that it contains plexus venosus juguli. Plexus venosus juguli. The damage, the injury of this region is very serious for the life of patient. Why? Because of risk of emboli. There are a lot of small veins in this region, and it could take place embolization of the blood. And now I'd like to demonstrate to you this specimen, which is placed in a special anatomical bottle fulfilled with the conservant fluid, formaldehyde. And so we can find that it's part of the thorax with organs of thoracic cavity. That means it's mediastinum. These organs of thoracic cavity calls mediastinum. And this is the lower part of the neck, together with muscles. Here it is, musculus scalenus anterior, its first rib. So let's distinguish the main structures. What is it? It's vena cava superior, most large vein of the upper part of our organism. It forms by connecting of two lesser veins. This question demonstrates vena brachiocephalica dextra, and from another side it's vena brachiocephalica sinistra. And between them, what is this? It's part of plexus venosus juguli. Plexus venosus juguli, which has one of the vessels named as vena thyroidea ima. It's part of plexus venosus juguli and vena thyroidea ima. So we can say that this vessel is located inside of spatium interaponevroticum suprasternale. This vessel is located in spatium interaponevroticum suprasternale. And what is this? Red color demonstrates that it's arterial vessel. It's arteria subclavia. And this arteria subclavia passes through spatium interscalenum, which is located between musculus scalenus anterior, here it is, and scalenus medius, here it is. So between them, there is spatium interscalenum. Arteria subclavia goes through this spatium together with brachial plexus, but it was cutted and removed for good demonstration of the blood vessels. And now, this arrow, where can we find it? Before, anteriorly to musculus scalenus anterior. Here it is musculus scalenus anterior, and the head of the arrow demonstrate the spatium antescalenum. So this is spatium antescalenum. Here, vena subclavia connects with vena jugularis interna, and together they form this vena brachiocephalica sinistra. So, vena brachiocephalica sinistra is a result of connection vena jugularis interna sinistra and vena subclavia sinistra. So, where is a head of this arrow, vena subclavia sinistra passes to connection with vena jugularis interna and forms this vena brachiocephalica sinistra. So I hope this example can help us to distinguish most important interfascial and intermuscular spaces of the neck. So, trying to summarize, we should know that in all examinal questions according topography are most important because they are of serious practical value. And that's why you should be very attentive when you read the textbook, this material concerning the topography and especially topography of the neck. Thank you for attention. Ты его сохранил, да? Нас будет слышно и видно. Мы обсуждаем.